everyone. Today I'm going to be talking to Dr. Safa Tahmasebi. He's a dent. Is it correct that if I say dentist, or is there another
Oh yeah,
technical name that I can use?
a dentist is fine.
All right. And we're going to be talking about implants. And what is it? What's the process to getting it? How the technology has changed, and so on. So without further ado, welcome to the program. Um, Safa, I want to ask you the first thing. What is the difference between dentures and implants?
Well, dentures, I guess maybe the generic name for dentures is false teeth, right? These are patients that have no teeth at all, and their teeth comes in and out of their mouths. Basically, dentures are made out of, say, 12 to 14 teeth attached to an acrylic base, and it sits on the gums, but you do have to take it in and out of your mouth. I guess maybe you were asking me to compare it with implants. Implants are titanium screws that get embedded inside of the jaw and get screwed into the bone of patients. And within a period of anything between 6 to 8 weeks, that bone integrates with that screw. So essentially, what you're doing is patients that have lost their teeth, you're essentially are putting the roots of their teeth back into their mouths, and then we attach a prosthesis or a crown or a bridge into those screws, and we give patients back their teeth, their function, and their smile.
So the big difference here is I can say one, it comes in and out, and the other one acts as permanent teeth.
Yes, we call dentures removable prosthetics, and we call implant supported prosthetics fixed, which means that they don't come out. They're
All right.
fixed into the jaw.
So in terms of technology, if somebody wants to get implants, I mean, first of all, who should come for an implant?
So, there's many different patients that will benefit from an implant. You have patients that have lost a single tooth. Let's say you get hit in the face during a baseball match and you lose a tooth, or let's say you are young and you have gum disease or bone disease as a result of genetics or as a result of some underlying medical condition. You lose your teeth, you're going to need implants. Or let's say that you go get a root canal and the root canal is too complex or it's way too advanced and the tooth has to be removed. Well, that person gets an implant. So I think there's a whole different bunch of reasons why people lose their teeth, and so whoever loses a tooth and wants to get their teeth back, implants can help them. Now, whether it's a single tooth, a bridge, tooth in the front, tooth in the back, or someone that has lost their entire teeth, implants can help these patients.
Uh, One of the questions that we've looked at and we've asked our community, which is a concern of theirs, is how long does this process take these days? I know it used to be a long procedure.
Mhm.
Is it still a long procedure?
So that's a good question. Yes, I think we've made some incredible advancements in the field of implant dentistry. In the 1980s, where implants were first introduced to the world, they were actually studied from the 50s, but they really became commercially available in the late 70s, early 80s. Implants were completely different than what they are. The connections were different, the screws looked different, the titanium that they were made out of were different. The titanium was a lot smoother. However, with advancements in biomaterials and biotechnology, we realized that if we change these screws, the surgical protocol and the materials of these screws, we actually shortened the healing time from 6 months to 3 months. And then later on, it became to 2 months. So right now, within certain implant companies that I work with, I'm sure there's different companies, but the ones I'm working with right now, we have companies that after an implant had been inserted into the jaw, within anything between 6 to 8 weeks, you're ready to install the prosthetics on top of them. So just 2 months and patients can get their teeth back. So yes, some incredible headway has been made towards implant dentistry.
On that note, if anybody is looking to get this kind of procedure done, and we're talking about implants here, what are some of the issues or concerns they should be looking for when they are looking for an ideal doctor or a dentist that they want to engage and have a discussion with?
So, as you know, experience is the best teacher of all. So, of course, you would like to go to a doctor, first of all, that has a lot of experience with implant dentistry. And second of all, you also want to go to a doctor that has very good technology. You see, in the past, when I started implant dentistry, if we wanted to take the right x-rays for patients, we used to send these patients to x-ray clinics or radiography centers or radiology centers to take what is known as a small field of view CBCT. These are little small CBCTs that you get in the hospital, but they have very, very low radiation, and it gives you a three-dimensional pictures of the patient's jaw, so you could measure how much bone is available to insert an implant. However, recently, I would say within the past 10 years, these machines have become available to dentists, and now dentists have them in their office. So you no longer have to go to a radiology center. So I would say go to a dentist that has a 3 CT scan in their office, who has incredible amount of experience. Typically, lecturers or people who have written books on implants are obviously favored. But specialists are also out there that do implants. I'm a specialist in implant prosthodontics. After I became a dentist, I studied an additional 4 years to become a specialist in implant dentistry. So also knowing that your dentist or your implant specialist is a specialist is also a very good thing.
The final question that I have for you, Safa, is cost. Is the cost of getting an implant something that the average person now can go to and get? Are there payment plans that people can take advantage of if the process is expensive? What are some of the cost implications involved in getting an implant procedure done?
Absolutely. No, for sure. I think uh, financing options in North America has made a great sort of contribution to allowing our patients to be able to get their teeth back. So yes, financing is available for these type of patients. And one thing that did happen in the late 1990s was we started placing fewer implants, but yet we were able to give their patients the full set, their teeth back. So I'm talking about patients that have no teeth at all. In the 1980s, we used to place like 10, 12 implants to be able to rehabilitate some of these patients. And very early, we realized that not only the surgical protocol was very advanced and tedious, but it was also very expensive for our patients. So now we have learned that within just 4 implants, we can put a full prosthesis on just 4 fixtures, and that is known as the all-on-4 protocol that most people are very familiar with. The all-on-4 protocol allows you to put a full set of 12 teeth on 4 implants. So yes, the cost had been reduced and financing is available. When it comes to single implants, even the cost of single implants has gone down, but there seems to be a little bit of variation on different costs amongst different dentists. I know that specialists typically will charge more for a single implant, but again, they're affordable. And I know that some insurance companies still cover single implants, or at least they contribute a partial amount towards the single implant. But yes, I think single implants are affordable, and we do a lot of them every year, and they have really helped us change people's lives.
Thanks very much for this conversation. And if anybody wants to get in touch with you, how can they reach you?
Oh, thank you. So I have a strong social presence on my Instagram. It's I could just say it right now. It's Dr. Safa.pros. Maybe you could put it up there. It's Dr. Safa SA F as in Frank A dot pros. Yeah, I guess maybe that would be the best way to find me and to see the kind of work that we are doing.
Brilliant. Thanks very much for your time. And if anybody's interested in getting in touch with Dr. Safa, you know where to go to. And we'll see you guys in the next webisode.
My pleasure, and it's always good to see you, my friend.